Okay, I think we're good to go.
Go first? Okay. Hello, my name is QiuHong and I'm the pharmacy intern here today. I see that you have a new prescription. I'd like to go over this with you today and see if you have any concerns or questions. Please remember that this conversation will remain confidential. So before we get started, can I verify your name and date of birth?
It's John Smith, and it's March 8th, 1992.
Okay. Do you have any drug allergies? Any medication allergies?
No, I do not.
Okay, great. So what did the doctor tell you about this?
I don't remember what he said.
This drug is called levodirexin, 30 tablet of levodirexin, 125 micrograms. This medication is for your hypothyroidism. So how did the doctor tell you to take this?
I don't think he told me how to take it.
Okay, once again, this drug is levodirexin 30 tablet, 125 micrograms. You should take one tablet by mouth in the morning, 30 minutes before meals. It's important that you take this at the same time per day, but what time is less important. The prescription is 30 days supply with 3 refills. Therefore, like the entire script is a 120 days supply. However, this medication is indefinite, so you should see your doctor after this 120 days to access your further therapy. If you happen to miss a dose, take the missed dose as soon as you think about it. If it's close to the next dose, you should just skip the missed dose and go back to your regular time. Do not take 2 doses at the same time or extra dose. You should store this medication in dry place at room temperature. Do not store it in bathroom. Keep it away from heat, light, and off reach of children. So, how did the doctor tell you to expect?
He didn't tell me.
Okay, so this medication will help with your hypothyroidism, which is used to add thyroid hormone to your body. This medication may take several weeks to see the full effect. After that time, you will know if the drug is working by having your thyroid hormone test. And there are some common side effects of this drug, which include hair loss. This may happen in some people in the first few months of taking this drug. This most often goes back to normal, so it's not a thing you need to worry about. And if you have high blood sugar like diabetes, this drug may sometimes raise your blood sugar. So it's important that you check with your doctor to see how to keep your blood sugar under control. So it's necessary to have your blood sugar checked regularly. And if you experience signs of allergic reaction such as rash, itching, red, blister, or peeling skin with or without fever, tightness in chest or throat, swallowing in mouth, lip, face, tongue, throat, or swell, or trouble breathing, swallowing, or talking. And if you see any sign of high blood pressure like severe headache, dizziness, passing out, or change in eyesight, you should stop the medication immediately and contact your doctor as soon as possible. So I know that we went over a lot of material today. Could you please repeat back to me some of important points that we went over?
Okay, so this drug is to treat my hypothyroidism. It's going to put more thyroid hormone into my body. I monitor this by taking a thyroid test, I think you said. And I take this pill once a day, 30 minutes before meals at the same time every day. And it's a 120-day supply. I might experience hair loss, which may go back to normal afterwards. And then if I have any rash, headache, high blood pressure, hives, anything like that, I should call my doctor immediately and stop taking the medication.
Yes, you're right. Awesome. So, what other question do you have for me?
I don't have any other questions.
Okay, if you ever do have any questions, just stop in or call the pharmacy.
Okay, thank you so much.
Thank you.
That was really good. You
Yeah.
talked at like a really good pace and you covered everything. So I think you did a really good job.
Alright.
Okay. Um, no, I think you did everything correct. So I don't have any critiques or anything. Okay. Okay. Hi, I'm Allison Murchison, your student pharmacist, and we're going to be going over your new medication today. Just know that this entire conversation is completely confidential. Can I first start with verifying your name and your date of birth?
My name is John Smith. Their birth is June 26, 1952.
Okay, thank you. Is there any like specific name you want to be addressed by during this counseling session?
John is fine.
Okay, nice to meet you, John. First off, do you have any drug allergies or have you ever had a weird reaction to any kind of medication?
I don't think so.
Okay. What did the doctor tell you to expect, or what did the doctor tell you this medication was for?
I don't really remember.
Okay, so this drug is called pioglitazone. It is the main purpose is to lower your blood sugar levels due to your type 2 diabetes. It is a 15 milligram tablet. You have a 30-day supply. How did the doctor tell you to take this drug?
He didn't tell me about this.
Okay. Again, this drug is called pioglitazone. It's a 15 milligram tablet. You have a 30-day supply. You take this drug once a day. It doesn't matter what time of day, anything you're comfortable with, and you take it by mouth. So you can drink it with like water, anything you really want, to be honest. It is important that you take this at the same time of the day or same time every day. It doesn't necessarily matter what time of day that you want, anything you're comfortable with and any time that you think that is good for you. This duration of therapy is a 30-day supply with 5 refills. So it's a 150-day supply. So when you run out of this 150-day supply, please make sure to contact your provider. If you are to miss a dose, make sure you take it as soon as you remember, or if it's really close to the next dose, just skip it and go back to your regularly scheduled dosage. And lastly, store it in a cool, dry place away from any pets or children that you may have. What did the doctor tell you to expect from this medication?
I'm not sure.
Okay, again, it's pioglitazone. It's supposed to lower your blood sugar levels due to your type 2 diabetes. It's going to get your blood sugar to a manageable level that's normal for you. Everyone has a different baseline or normal blood sugar, but we're just trying to get it lowered due to your diabetes. This drug may take several weeks to hit max effect. And to monitor this, I would recommend taking your blood sugar 2 to 4 times a day. Just write it down or just like make sure that you remember like what like numbers is around the average, whatever. If it gets really high for you or really low, contact your provider immediately. There are some side effects to this drug. One is edema and the other is weight gain. Edema is swelling of the face, hands, legs, and ankles. This, in order to monitor this, I don't want to prescribe you something else. So I'd really recommend if you notice any swelling in your legs to elevate them on like a chair or a couch cushion, something like that. And to also regulate edema and weight gain, I would recommend a low salty diet because high salty diets contribute to both of these side effects. There are also some rare effects that I want to talk to you about. With edema, there is a slight chance of heart failure. This includes if you have any symptoms like shortness of breath, muscle weakness, fatigue, really significant swelling in the ankles and legs, stop taking this medication and call your doctor immediately. Other rare side effects are anemia, which is like iron deficiency. So make sure you're eating a lot of like iron sufficient cereals. And then one other thing that's rare is low blood sugar levels. So again, monitor your blood sugar 2 to 4 times a day. If you have any concerns, call your provider, or stop taking the medication and call your provider immediately. I know that we covered a lot of information today. Can you recall any of the things that I said?
So this medication will lower my blood pressure, and I should take this once a day, like any time of day, but just keep in mind at the same time, this drug have like total of 150 supply. After that, I should contact my doctor to further access. And if the common side effects include edema and weekends, I should like if I have it like swallowing in my leg, I should elevate that like and I should like low salt diet. Like I should take my low salt diet to avoid the side effects. And if the severe symptom like shortness of breath, something like that, I should contact my doctor immediately and stop the medication.
Okay, really good. So you're taking this tablet once a day at any specific time that you choose at the same time every day. After you finish the 150-day supply, contact your provider, talk about and address any of the concerns that you may have. Because this is an indefinite supply, you may be on it for a long time due to your chronic diabetes. Again, just contact and follow up with your provider after this medication supply is gone. Do you have any other questions or concerns for me?
No, I don't.
Okay, it was really nice to meet you, John, and I wish you luck with your new medication.
All right, thank you.
You're welcome.
Okay, so I think you went over like basically every point like issue. Yeah, you went over.
Yeah, I think the only one I missed was when I was talking about the 150-day supply. I didn't say that it's indefinite prescription. That's I know I definitely missed that because I remember I started the next question. I was like, I didn't say that. But
You catch up in the like last part.
yeah, I said it at that part because I was like, I'll just leave it for the end to do that. But yeah, I think I was a little nervous. But this is a mock interview. Okay, I'm gonna stop the recording. How do I stop?